My name is Angela Brand. I use she, her pronouns, and I'm the project director with the Crisis and Recovery Enhancement or CARE TA Center. I want to welcome you into today's session on suicide prevention. Where are we today?
Thank you so much for joining us today. My name is David Lopez. I have been with CARS for just over maybe 4 months now. Previous to that, I've been the director of the 988 Lifeline Center in the Central Valley. I was a clinician working in mobile crisis units before that and have extensive experience working in inpatient units. And through the work that I've been doing throughout the years, it's really given me a great deal of privilege to work with so many people. But for today, what we want to do is we want to start off by looking at the suicide data that we have and exactly how do we interpret it over the last couple of years. One of the big things that I want to spend some time on is actually looking at living in a post-pandemic society, what that looks like for us, what that looks like for our mental health, and how that data translates to what we can use in our suicide prevention effort moving forward. Like any suicide prevention piece, I want to spend some time on the signs and about the risk of suicide. Looking at our impact of social media and how that's impacting suicidality, and some tips we can do that. The importance of increasing our surveillance throughout the communities and what that means. Simple and easy ways to increase resilience, leaving us with a moment of hope on what we can do to help increase that. And then have some lived experience from myself and Angela, and then turn it open to a Q&A section for all of us to just ask any questions and share where we're at right now. So suicide data, we're going to start off with the latest data that we have from the CDC. Unfortunately, we look at the deaths of suicide. That's what we're going to start with, and what we have from the data of 2021. Currently, the population in the United States was just about 333 million people. At that time, of 2021, we had 48,183 people who unfortunately died by suicide. Aside from that, from the data that we can gather, we know that 12.3 million adults seriously thought about suicide. 3.5 million adults made a plan to die by suicide, and 1.7 million adults attempted suicide. So when we're thinking about, and we know some of this data, let's start the number of 48,000. This is coming directly from the CDC's data. And if anyone's familiar, or I'll ask if anyone's in the chat is familiar, how all the deaths by suicide are recorded up to the state and or local districts. So it's best data that we have right now. What we're looking at, it potentially could be higher. Aside from that, there's some additional things that we know why this number could be skewed. There's a phenomenon called a cloaked suicide. And what a cloaked suicide is it's when someone takes their life and in a manner to make it look like an accident. And the reason can be many. It could be to protect, the name of the family, to protect their reputation. It could be for them to potentially make sure that they can receive that insurance benefit. A lot of different ways it can happen. So even if we look at cloaked suicides, and one of the biggest ones that we see is like single car accidents, someone just wrecking off into a tree, driving off in the freeway, someone doing things like by accident, like excessive, like reckless behavior. And so with those deaths, looking at it, we know that death rate could actually be higher. From this, we also have to acknowledge that we have some very vulnerable populations in our communities that we serve. The first one being Native Americans. They have an increased death rate by suicide. Veterans, older adults, especially when we look at older adults. I want to spend a moment here. People over 85 have one of the highest suicide rates. Then we look at 75 to 84, and then we're looking at the age group of 25 to 34. And if we look at that percentage of 19.6 per 100,000 from 75 to 84, and 25 to 34 at 19.5, what we're starting to see is that age group of 25 to 34, and their risk in their actual death by suicide increasing. And that's something for us to take note and be concerned with when we're looking at how we're marketing and using our suicide prevention efforts. Of course, we want to hit as many people as possible, but with some targeted messaging to these vulnerable populations and considering their age group is something that we should consider around this. Our LGBTQ plus communities are definitely at a higher risk population. People in rural communities, they may not have the resources, they may not have the knowledge, they may not have enough awareness in the different campaigns. There may be a lot of different fear. I live in the Central Valley in California, and when I look at our rural communities out here, a lot of it can be our farm laborers, people from migrant communities, and they're struggling with the same mental health issues as everyone else. However, they may not seek out those resources or help for fear of what can happen to them. And then people of color, historically, people of color have been marginalized, have not received the same amount of care, and in those communities. So we want to make sure that we look at these people and these populations, and we want to look at our suicide prevention efforts and how can we help enhance our suicide prevention efforts in these communities. So now I want to talk a bit about adverse childhood experiences, what this is going to mean with our suicide prevention data. So the original ACEs study was a lifespan study that was done about 17,000 participants, completed by Dr. Filetti, and these were both medical doctors that were from Kaiser Permanente. And so it actually started off with a weight loss study, but then they were looking at why these people continue to regain some of that weight. And then in looking at what this was, that these individuals ended up being impacted from several factors and what we call adverse experience, or what they called adverse experiences. These include abuse, the physical, emotional, and sexual abuse, neglect, physical and emotional, and then household dysfunction. These mental illnesses, substance use, mother treated violently, and incarcerated relatives. When we think of this, keep this in mind as we look at this next slide on what ACEs can actually lead to. So the findings from the ACE studies, they have these possible risk outcomes. And the first things we're going to look at is the behaviors, the lack of physical activity, increased use for alcohols or drugs. They can miss work, and they can engage in smoking. It can definitely have an impact on physical and mental health. They can have severe obesity, depression, diabetes, sexually transmitted diseases, suicide attempts. And then we have increased health risks, potentially being heart disease, stroke, COPD, broken bones, and cancer. Here's what the research has showed us so far throughout the pandemic of what we've seen. The first part I want to look at is what the pandemic, just a recap, right? We know the pandemic comes, it's a very unique hazard. And the research that we look at, natural disasters, is what we're going to leverage on. So a pandemic comes in waves. It can last several months, even years. That's what we experienced throughout the COVID-19 pandemic. We know and we've seen that mental health conditions were exacerbated, and mental health issues during that time heightened, continue to emerge, maybe started due to social isolation, the increased stress, the unknown, the anxiety, the fear of the future, things that you all notated in there surrounding this illness alone. So here's what we know after a pandemic. Okay. In the short term, there's a drop in suicides immediately after the natural disaster. Okay. So a pandemic and natural disaster, there's a sense of community. People tend to come together. And if we look at the actions that we took as a community to look at, we were all working together to stop the spread. We were all sheltering in place. we were trying to all do our best, to wear face coverings or to watch out for each other or protect our elders or limit our visits in context, social distancing. Everyone was working together to try to defeat this external enemy, which was COVID, that was impacting our society. That sense of community, while at least the mentality was we're going to get through this together. Now, what we did also see is that because this pandemic was influenza, we saw that it isolated us, and it kind of offset some of that social connection that we may have normally seen, that normal communities coming together around. So somehow we all came together, but it was at a distance. So when we look at COVID-19 as a natural disaster, we have to look at and consider what that prolonged effect will have on our mental health, and specifically what that prolonged effect will have at the risk of suicide. Okay, so if we just said that during that natural disaster piece, or during that immediate time after, suicide death decrease. However, the risk starts to increase is what the research shows 18 to 24 months post-pandemic or post-crisis. So it seems like as a community that we have all just emerged from this pandemic together, society is restarting up, we're working and having this piece going. Now, what we can see is that potentially as we end this COVID pandemic, the increase for suicide could potentially go up. Now, here's what I want us to know. And in the communities I've been working with previously and what we've seen, I had been notating this data, that this was the potential risks that we would see, that there would initially be a drop in deaths by suicide. However, once we started to exit that pandemic piece, that there could potentially be a rebound and an initial increase. If we look at the data right before 2019, we start to see the dip 2019, 2020. So that data reflects what we initially see during the actual pandemic, during that natural disaster, right? Now, if we happen to look at 2021, we're looking at a return to return to the rates of death by suicide of pre-pandemic levels. The preliminary data from 2022 is showing an increase over that 48,000. It's looking closer to 50,000 that we have known deaths to suicide. Now, looking at this curve, we had the dip. That was what the data projected, and now we're seeing the increase here. Okay, this potential increase could be a prolonged effect for the next 18 to 24 months of what we're experiencing. And that would just be from the pandemic itself. Now, if we also look at what the pandemic affects and draw a correlate to what those adverse experiences were, that we can also see that adverse experiences can have an increased risk of suicide. That is something that we should be aware of as we move forward. So the impact on mental health for youth and children, the pandemic and subsequent lockdown quarantine had a huge impact on emotional health, and even more impact on social development that compared to adults. And if you just look at the developmental stages of children and youth, we know that they're still learning. There's a lot of engagement, social learning, social cues, social norms. Children were not allowed to interact with each other. Some people capstones events, graduations, proms, promotions, games, things that were very, very important that us in the community when we're raising children, we put a lot of importance on, you need to graduate high school. We want to make sure you walk. We want to make sure you go to that first dance. We want to make sure you do these things. And those events weren't held. They weren't celebrated. They weren't looked at. And it's kind of, now that we're posted, it's just like, oh yeah, we're supposed, all them are our children and our youth that experience all these things are supposed to move on like it didn't happen. And what are we doing that we can address that to help them celebrate what should have been, or acknowledge the fact that they did miss out on some of these learning opportunities, these engagements, these things that were capstone events for them. The increased anxiety and depression was present amongst all age groups. And as we looked at it, the increase, one of the things to think about is we were all looking at different strategies, those in the helping field, of how we can continue to serve. You know, we all of us pivoted really quickly to Zoom, to how we can deliver some sort of services. But that face-to-face connection for someone that's developing is very different. So this increased prevention and the work that we're doing moving forward, we should take note that there's some things that they missed out on. We should acknowledge that with them. And then how can we use this to help us move forward? So this is the post-pandemic findings and the research that we've seen so far. We have saw that the research has shown that there's an increase in symptoms and anxiety and depressions to this point. Individuals experience job loss. Young adults, women tend to have an increased, or at least a more reported a higher increase. During that time, we know that increased feelings of hopeless and sadness were there. The research was showing this was higher on younger women than compared to men. However, I believe that men just are not as likely to come forward and say these things. We did see an increase of deaths in drug overdose. We did see a lot more in alcohol-induced deaths. And that increased sense of hopelessness and suicidal ideation was among all ages. When I'm saying all this, and we're thinking about this impact, it seems a bit overwhelming. And when I'm thinking about it and I say it's overwhelming, it's like, wow, we all went through this together. And these are the concerns that we have noted. And how are we going to use this information and this experience to grow forward together? And I say grow forward intentionally, because we're going to continue to have to work towards this, to increase our work towards, for ourselves, for our communities. How do we increase our suicide prevention efforts? What can we do as a community, knowing all this? So one of the things I want to think about is social media and how the social media impacts us, how it was increased. We just touched on how we pivoted and how we started using technologies to help interact and engage with each other. But prior to that, social media has an impact on everyone's lives a little bit different. Does everyone, and this is almost a joke, but how many people have a cell phone these days? All right, how many, they're ubiquitous in our society. How many people have a smartphone, a tablet? If you look around, even your workspace or where you happen to be watching this today, how many pieces of technology do you have around you? How many things are going off at any given time? Right? What about our children and youth? And that's just technology piece. And I want to get into what social media and how it can tie in to our suicide prevention risk. All right. So here's what social media risk could potentially be. There's some research that's been emerging since social media is relatively new, new to the last 20 years, 10 years. We have seen it for what happens between when people engage in heavy social media use. You do have an increased risk for depression, anxiety, loneliness, self-harm, and even suicidal thoughts. Now, if social media is supposed to be social, and it's supposed to bring us somewhat together, and in the chat, can you put your thoughts on why potentially it could increase depression, anxiety, loneliness, comparison, comparing your life to others online? Sure. It's social and word only. News information overload, cyberbullying, negative comments, lack of face-to-face stimulation with others, quality time with others. Yeah. I wonder if people are depressed, are seeking out social support or support on social media, not finding it. Yeah. Bullying, a placeholder for more meaningful connection. It's 24/7, never stopping. Low self-image. Not everyone's able to recognize social media is all fake, no real friends, not real friendships, algorithms, incorrect information, misinformation, yeah, doom scrolling, catfishing. Some of these really stood out to me when you think about that comparison piece, comparing your life to others, cyberbullying. You know, when I was a child, you know, growing up 30 years ago, if we were being bullied at school or an incident happened at school, by the time we got home, that incident wasn't bothering me again until the next day, right? But our youth, they're experiencing it. That information overload, I love that being notated, that it's constant. A constant barrage of images, messages, of news feeds of what's happening in the world, this and that and this. And it seems like all those attention grabbing headlines that we can engage in, they're never positive. And so this can overwhelm someone. So while social media could be a place where some people can gain connection to others, it can also potentially have those risks when it's heavily used to have an adverse effect on us. So signs of this social media overuse can be the preoccupation that people have, the increased time of social use media sites, to determine the health of relationships. And I'll speak to that in a second. Requiring extended periods of time to gain that initial satisfaction, unsuccessful efforts of the ability to control or stop social media, becoming restless, sad, and anxious when there's an attempt to actually control that social media use. So when we're looking at, we talked about that connection piece and that comparison and social connectedness. Think about, I'm going to speak to our youth who may not have that many outside connections, or they're using that as one of their primary drivers to meet people, to engage with people, where it can have, where at one period it can have a good effect. But what about, let's look at if someone's looking at it for a determinant of one's health in the relationship. Let's say you are friends, someone posts a picture, and then they didn't like that picture, or a friend that you thought would like it, they didn't like it. So now this internalizing messaging of, well, is something going on? Do they not like me? That external sense of validation for that relationship now is not being supported. That internal self-dialogue, did I do something wrong? That self-critique that people can engage in. They're looking, or they can look at this as a form to validate their social connectedness. And if they're not getting this immediate response, which is also like a dopamine hit, this feedback loop that they're looking for, it can dysregulate someone's emotional state. what could be as a tool to help connect could adversely be something that people cannot, if they're not getting that instant validation, that instant response, because everything's so fast these days, it can start to shift the way someone moves, someone feels inside. I see some great comments here. Even with texting, if you don't get a timely response, you can get paranoid thinking, is that person mad at me? Sure. And so we're looking at this, and we have to take a moment to for ourselves, for our loved ones, for those around us. When we're looking at suicide prevention, some of these pieces are actually going to be on how we engage and how we can message around the use of this technology, because it is emergent. If we're knowing and we're seeing that this can increase risk, that it can lead to some anxiety, some depression, how do we message around that? How can we help slowing it down for individuals that are experiencing this? How can we help position or transform their thinking? Because right now, what I think when we're seeing some of this data, and it's me, this needs to be done, this needs to be right now. It's a very egocentric with no perspective. Like everything's like, if you don't get that response, something's wrong with me. And the individuals are putting it on themselves. They get worried, they get anxious, and internalizing that non-response. And that's a risk. So how do we help each other? How do we help our communities know that they can help peel back some of that? Has anyone, and this is for a comment in the chat, has anyone found themselves proverbially scrolling or going through news feeds? Has anyone, I'm seeing some heads nodding. Yes, of course, at all times. Yeah. Okay. Has anyone found themselves doom scrolling every day? Okay. Internet. So you tend to scroll. Has anyone found trouble or potentially being at night and their phone or their social media devices with them in the bedroom and they're looking at things? Yes, hours goes by 5 minutes every night. Absolutely. Yeah. Would you lose track of time going to bed late? TikTok deleted a lot of social media. Sure. And when we think of these things, right? If we're looking at two habits, just doom, we call it, I'm going to use the doom scrolling, that's one. And then if we're taking social media devices in bed with us, that potentially could lead us to staying up later, to not getting that healthy amount of sleep, right? To not being restful and mindful about what we're doing, about waking up in the morning and the first thing people are doing is checking their phone or technology device. Is that input necessary the first thing you wake up in the morning? Is it absolutely the most important thing to have your phone as your alarm clock? And if your phone's your alarm clock, and this is a question, right? If your phone's your alarm clock and it goes off and you shut it off, just a guess, what's the next thing you're doing after you shut off your alarm clock? Would it potentially be starting that cycle again? Going back to sleep. I love it. I love going back to sleep. Yeah, that could be one. Snooze. The influence it does to some people, copying themselves on TikTok, hurting themselves. Potentially, it could be for individuals, open social media, check their emails immediately, right? It could, and social media could be our work. Like, oh, you have to get up, you have to look at that work email, you have to see what's going on right now. You have to see what's checking messaging apps. You're starting a cycle instead of allowing yourself a moment to gather yourself, to take a moment, to start your day in a relatively good fashion. One of those things you could potentially help messaging when we're thinking about, when we're looking at this and we're looking at how we can message to help reduce anxiety and depression. Some of the messaging and tips we can use out there when we're using these campaigns is to help drive or shift the behaviors in individuals, for our children, for ourselves, for adults, to help reshape the way we're using the social media piece. We could encourage people to set screen time limits. We could encourage individuals to set an hour before, shut off all social media devices before you go to bed. We could encourage sleep hygiene, because that we know that blue light keeps you up, or blue light does keep you up later. It doesn't allow you to go to sleep and enter REM sleep earlier. There's some things and shifts that we can do with that to help us go. And if we are infinitely scrolling at night, or our children are, that's one thing. And I know I've heard from a lot of my friends and fellow parents that we ask our children to put their devices away or leave them in another place, and then sometimes we'll catch them with the iPad in the middle of the night and they're supposed to be asleep. And how do you control that? But even as adults, how can we do that? So when we think about suicide prevention, I want to explore some of the past campaigns that we know. There's been several out there that are really, really good. Each Mind Matters, Know the Signs campaign, Be the One, Zero Suicide, the Lifeline and 988 efforts. And when we think about these campaigns, how many of you are familiar with the Know the Signs campaign? If I could see a hand up, I'm checking the room. How many people? Yeah, raise your hand. How many people have used these types of tools in their suicide prevention work in their communities? Are we familiar with them? Are we using them? What's worked and what's not? A lot of these campaigns that we use, they have really great messaging. They're encouraging us to know the signs. They're encouraging us to learn the words. They're encouraging us and providing different toolkits and techniques that we can use in our own communities, that we can help steer some of these efforts, right? But how we individualize and use these tools when we create our own network, or what we create our own stuff that's community-based, that's community-specific, we always don't have to reinvent the wheel. We can leverage back on this. And I'll touch back on this in a second. So let's go on what the signs of suicide risk are. Now, when we think of signs of suicide, there's a lot of different things we can consider. Some of it being initially the suicide thoughts. People can have substance use. They can have feelings of purposelessness. They can be anxious, feel trapped, hopeless, withdraw, engage in risky behavior, and even look at ways to act upon those suicidal thoughts. Now, those are those universal signs that we think of. And when we think about anxiety, that's the first one I want to touch on, feeling anxiety and being trapped. They seem connected to me. When people are thinking about suicide, they tend to inherently become more anxious. They become more anxious because as human beings, what are we innately designed to do? If we look at us as just creature, like it's just another people on the planet, we're innately designed to survive, to engage in activities to secure our survival, right? Whether that's finding food, shelter, providing for our loved ones, eating, shelter, like basic needs. If someone were to try to, and you're wandering around, someone's gonna try to push you, that fight, flight, fawn, fees, all those are survival instincts. Well, when someone's contemplating suicide and they're thinking that they want to end their life, right? That energy, those thoughts are attempting to override our innate ability to survive, which isn't a very anxiety-provoking experience for individuals. When we think of why individuals get so anxious and how they can seem nervous, and that nervous energy can be for those intervening in that crisis work, that's a big sign right there. They're contemplating this, they're feeling trapped, they don't know what to do. And when you think of this anxiety and feeling trapped and hopelessness, the way it expresses itself could be behaviorally different ways, right? When someone thinks of like, oh, they're angry. I want to talk about anger real quick, right? One of the things that we've seen, or I've seen a lot when I think at some of those people, some individuals who've died by suicide and their behaviors before, or individuals who have made severe attempts in their behaviors before, not only were they acting not in their normal state, but a lot of them engaged in behaviors such as anger, or trying to distance themselves from close feelings or from close connections. And so when you're looking at that close connection piece, or those anger outbursts, or that distancing, it's a way for them to withdraw, right? And if they're acting anxious and they're trying to withdraw, they can use it in a way that to people can seem like, oh, something's just wrong with them, or they're just backing up, or I don't know, they haven't been the same, they've been acting up with me, I don't really know if I'll deal with that angry person anymore. How comfortable you are addressing it with someone that you're not meeting in your professional world, in your professional role. I share a story about someone that we've lost, a friend, part of my friend group, and so I'll just share. When we lost a friend a few years ago to suicide, some of these signs of that withdrawal, of that not engaging, of that substance use increase, were there. And if I look at not coming to the local gatherings, to not looking to things that we would usually see them at, they've just been acting different these days. It could be dismissed as, they're just going through it. But if they start to gather, there's more than one things. Will we ask our own friends? Will we ask our own loved ones about this? It can be harder to do. And so as we're all here talking about suicide prevention, I really want to spotlight the moment, or the importance of us checking in on each other as well. You're here watching me talk about suicide prevention. Therefore, I know innately, you're involved in this work somehow. You want to learn more. And that means you're giving out a lot of energy. You and your teams are giving out energy. You're caring for others. You're a helper. You're a giver. And you tend, or maybe I'm just speaking to myself, but those in the helping professions tend to help others a lot more. And they'll do a million things for a million people with all the energy and gusto and put themselves. Because all of this are upstream approaches to avoid the burnout, to avoid the stress, to avoid us dealing with potential thoughts of suicide. Like, why am I doing this? Some of the universal signs that we know that marked personality change in the individual. Something suddenly changes in the way they typically behave. Usually they're showing up on time. Usually they're, chipper. Usually their mood is, we know their mood, we know the way they are. And now all of a sudden, maybe they're not chipper, maybe they're not as engaging as they were. The other is also true. If we know someone that's potentially melancholy or has been down for a long time, and all of a sudden they're better. Jack Claude, who's a suicidologist, had mentioned, he has a theory, it's called the miraculous recovery. And when he speaks about the miraculous recovery, he talks about someone who is now made peace with the thought of taking their life. When we think about suicide, right, and the individual who's contemplating or thinking about suicide, they're viewing suicide as a way for them to end their pain. They're looking at suicide as a way to resolution, to find an end to their pain. It is a solution to their problem. They are not viewing suicide as the problem, it's a solution. So when we're looking at that, we really want to engage and acknowledge individuals for where they are and looking at there's things going on in their life that could be so bad that they're thinking about taking their life as a solution. And what Jack Claude speaks of is this miraculous recovery. It's to that personality change for someone that may be going through it for so long, and all of a sudden, everything's great. They're okay. And it potentially because they have made peace and they can go on to attempt to take their life. We have to be aware of the personality changes both positively and negatively, both meaning like, an increase of energy or decrease of energy, something that's a sudden mood swing. Agitation is when I was speaking to. Individuals can be uncharacteristically agitated, angry, or moody. They can have problems controlling their temper, seem more irritable, can't calm down, unable to sleep, and may explode over anger and a minor problem. Unable to sleep is a really big one, and I'm going to speak to that in a second. Withdrawal, the person can isolate from themselves or friends. They can stop taking part of activities they enjoyed. They do not engage in their regular self-help care like they normally would, and a person is feeling really hopeless. They used to be optimistic, but now they can't find anything to be hopeful about. Our minds are stressed, our brains are not active. That's why we shut down into that REM sleep. And that's that time where we can rejuvenate. Now, if we acknowledge that, we understand that if we don't have sleep or we have lack of sleep, that can increase our ability to, or decrease our ability to withstand the daily pressures. Our tolerance can go down or drop. Our ability to ration can decrease, or rationalize can decrease. Our temperament may not be as resolved or calm as it normally would be. For the individual that's thinking about suicide, for the individual that's now scrolling and comparing their life to social media, to the individual that's staying up night after night after night, looking, could that have a compound effect on their ability to reason, on their ability to internalize, to actually view perspective? Could it potentially decrease their ability to engage with other individuals? This is how that connection piece comes in. When we're looking at the sleep component, we're looking at social media, we're looking at COVID-19 pandemic, we're looking at all these experiences that are all interconnected, right? That one can lead into another, can lead into another, can lead into another. And we have to start looking at unpacking some of these things one step at a time in our prevention work. What can we help the individual do? What can we help the community do? How can we help them maybe solve for one of these things to reduce a little bit of this stress? So how do we talk about someone, suicide when concerned for someone? It can be a very, very hard subject to broach. especially if it's not in your professional role. And even then, it could still be something that's challenging. I'll acknowledge that. I want to start off this section by a story and how we can engage with people in our everyday lives. So years ago, I used to work downtown in a big building downtown. And we'd all come in, all the people come into the elevators. I had about six or eight elevators, I can't remember. And I'd see individuals every day come in. And all of us would go get into the elevators, pack in, everyone would go up to their respective floors, get out, and everyone's walking around, just going about their day. Almost like ants in an ant farm. You go in, you go out, go in, check in. And during that time, many people would exchange pleasantries. Hey, how you doing? Hey, how's it going? How you doing? And what's the normal response for individuals when you're walking around? Hey, how you doing? How's it going? What do people tend to say? Please put your response in the chat. Fine. Good. I'm good. Good. How are you? Good. Okay. Yeah. Candid response of good. I'm good, and you? Making it. Okay. Saw a lot of goods. Some stress. The good response. Light ran. When I'm masking, it's good or okay. Masked, I can be more honest. Thank you for sharing. That's what we're going to tie in a second. We're programmed not to handle anything other than good. When I would walk in, I would say every morning, hey, how's it going? Good. And I keep it pushing. How's it going? Good. Keep it pushing. And when we're talking about this, hey, good, keep it pushing, it's almost like none of us ever want to say anything other than good, keep it pushing. Every single one of us in the world has a life. Every single one in this audience today has a personal life. We have a public life. Us, by going around saying, hey, how's it going? Good. That could be something that us is just, hey, I'm good enough, I'm here. I just want to get through the day. We're not checking in to see. We're not asking to know what's really going on. That good. We don't know about that individuals if they got in a car accident, they got cut off on the road, that they're having trouble with their kids, maybe their kid got expelled, they're having trouble in their relationship, maybe they're having troubles at work, financial problems, whatever it may be. That's that social mask that we wear as people. And we can go around saying good all the time. And that good could be us to get through the day. But how do we engage with someone besides that? Especially if we're just talking social connections. If you think about the signs and we're seeing the behavioral changes, and maybe even you're seeing someone at work. Second, you say someone's name. It engages us just a little bit different. And it's those simple things that we can use, the power. Yeah, the power of names. Thank you, Gerger. That we can do to change that, hey, how's it going? To how you doing, Xavier? How you doing, Jose? How you doing, Angela? And if we're worried about someone, we could couple that with some of those things of, checking in. Maybe you want to find the right time and place to do that, of course. That's safe. But it can engage just someone a little bit more by the acknowledgement and the use of someone's name. How do we start the conversation? For those that may not have engaged in this conversation before, or that have, we want to make sure that we can have some suicide crisis resources available, or at least review it with us. We want to talk about those behaviors that prompted us to ask about the suicide risk, or potentially what we're seeing going on with that individual. If I'm going to speak to someone that I know, I can say, hey, how's it going? Usually get the good. Oh, let me change it. Hey, how you doing, Angela? How you been? We're in a space so we can actually speak for a second. And when I'm going to have this conversation, I'm leading with the intention to receive whatever they can give us. The last thing we want to do is start a conversation with someone that we could potentially be worried about, and then not give it that time that is necessary for them. Once we start that conversation, whatever it may be, hey, how you doing, Angela? We can start to speak to what are those behaviors that we've been noticing. Hey, I've noticed you haven't showed up to our PTAs lately. Hey, I see that you haven't been as smiley or energetic as you are. Is everything okay? You want to just engage with a few of those conversations and those behaviors that you've seen, because now that individual, two things. One, it relays to them that they know that you're actually paying attention to them as a person and what they're doing. It conveys interest, and also it allows them now not to just have an easy out, everything's fine. So it's more engaging. We ask questions. One thing to note, if you haven't heard this, it is okay to ask directly about suicide. The old thought or the premise would be, if we ask about suicide, it's putting the thought of suicide in someone's mind. And that's just not true. I've taught clinicians when we looked about actually doing crisis assessment and intervention, they would ask about a lot of questions that weren't about suicide. They would say, are you thinking of hurting yourself? Are you thinking of harming yourself? Have you done anything to hurt yourself today? And we want to be clear that they're looking at suicide as a way to end their life, to end their pain, not as a way to further hurt themselves. And it's important that we differentiate between the two to do that. Again, talking about suicide does not put the idea in someone's head. They could actually be relieved that someone's asking and get the actual full effect and understanding the gravity of their situation, as opposed to minimizing it. Hey, I understand that this is so tough for you right now that you're actually thinking of potentially taking your life. And hearing their story for what it is. During this time, we want to make sure that we listen to whatever they have to say, both good and bad. We definitely want to relay our concern. We want to reassure them as much as we can. We want to listen to the reasons both that they have for living and that they have for dying. We want to validate them and help them consider the options and underscore that living is an option for them. We want to hear their turning point, whatever their hopes, their dreams are, whatever it could be that could keep them going. Hope is a very, very powerful thing. We want to let them know that they care, that you care. And we also want to let them know that we take that situation just seriously, that they're thinking about suicide. We're concerned about them. That'll really go a long way to help support someone. Words and connection and just slowing down the day are so powerful. The other day I was in my local gas station. And I would say I have a friendly relationship with the local gas station here. It's the one I usually go to. And this guy's usually in there. And I talk to him every day, and we pass those social greetings like usual. Hey, how you doing? Good, 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 good. And one day I just noticed that he wasn't feeling so well or didn't look his normal self. And I just, being the person that's trained in this, how you been? You look a little tired, you look a little down. And it was just me and him there. And he started telling me he was feeling depressed. He's tired of work, working all the time. I've been struggling. I talked to him for about 10, 15 minutes. We really just were able to connect for a moment and just help unpack him. Found out his name, talked to him. At the end of this brief interaction with someone that I'm familiar with, he was like, hey, thank you for checking in. Really appreciate it. Doesn't take much. We can all do that for each other. Some simple, not easy ways to improve resilience. So to leave us on some positivity. Resilience. What does resilience mean to you all? If you put it in the chat box real quick, when you think of resilience, what does it mean to you? If you would just put a response to in there. Strength, overcoming adversity, never giving up, bouncing back, consistency. Yes. Strength. Pushing forward regardlessly, withstanding, making it. Ability to cope. Thank you. Carry through difficult times. Continue to move forward despite setbacks, being able to bounce back after difficulty. 100%. Adaptability. Yeah, resilience is a very, very powerful tool. And life has a lot of different ways of coming at us at any given time and giving us different tools. The way we view our life, our perspectives, the reshaping and reframing that we can do towards it. They all have an effect. So some things we can do is make every day meaningful, living with gratitude, having a gratitude journal, starting off with what you're thankful for. When I call it, this is like when we talked about social media, that comparison society, we're comparing ourselves to others. We can do that. Keeping up with the Joneses was a term that's I'm more familiar with my age. Looking at what everyone else has, what everyone else is doing. Taking some simple time to be grateful. Building social connections, making time for friends and family. Exercise, movement is key. The 15-minute walk, starting your day. Taking some deep breaths, engaging in community. Learning from your experience. Oftentimes we all can forget how far we've come and how many things you've overcome and how much further you can still go. It's important to reflect back on life's wins and use that as a source of strength. It's also important to reflect back on what you've overcome. So many of us run through this world fast, and it's almost like, yeah, that's what we're supposed to do, it's what I'm supposed to do. Celebrate those wins that you have and encourage others to do the same. Make time for yourself. Find a pastime that brings you enjoyment and sparks your creativity. And remain hopeful. Hope for a better tomorrow is a powerful tool in resilience. For youth, some tips. We definitely want to encourage connections. And when I look at the work by Dr. Bessel and trauma-informed care, and I look at his work, he has a lot of different programs that he's highlighted and these things about how movement, dance, theater, all these things can help create those connections to strengthen community, to make them feel better about themselves. Help them maintain a daily routine, allow them to take a break. We want to teach our kids some self-care, help them move towards goals. Definitely want to nurture a positive self-view, help keep things in perspective for them. Us as adults need to do that. And of course, again, instill hope. So increasing surveillance in our community is one of the big things we can continue to do in outreach. And we talk about surveillance, it's more the more people that we have that are aware of the signs, people that are aware of these behaviors, people that can have touch points with individuals. Outreach events are really a good way for us to help reduce the prejudice around the topic of suicide and mental health. Increasing gatekeeper training, such as like QPR, Suicide 101, how to start the conversation can help that. We can offer it to businesses, schools, churches, clubs, and social groups. This is really powerful. We want to really move towards suicide prevention and awareness, QPR, and we want to get that message out there because together we can definitely make a difference.